So one of the most common complaints we get for people who come to see us for orthodontic treatment is crowding. And put simply, crowding is when the size of your jaw isn't big enough to accommodate the number of teeth. So with the teeth being crowded, they're often in the wrong position. So people get confidence issues from their smile because their teeth are crooked. You can also get situations where their teeth inside and outside the bite. And leaving the teeth like that long term can lead to tooth wear, chipping, and the bite generally being uncomfortable. So most people will come to see us for aesthetic reasons for crowding and also functional reasons for crowding. So generally there are two ways to treat the crowding. We can increase the size of the jaw to accommodate the number of teeth, or we can keep the size of the jaw the same and reduce the number of teeth so they fit into that size. And which option we go for can really depend on a number of factors. It can depend on the severity of the crowding, how wide your jaw is at the moment, the angle of the teeth, where we want to position the teeth in your smile. And each case might be a little bit different. If we were to widen the jaw to accommodate the number of teeth, then typically we would prescribe what's called an expander, which widens out the top jaw, and sometimes that can give us enough space to fit all of the teeth in. Sometimes it's not biologically possible to widen the jaw enough to fit the number of teeth in. And in these types of situations where the crowding is quite severe and extreme, we might consider what we call dental extractions, whereby we reduce the number of teeth so that they can fit into the size of your jaw. We also have a third option where we may choose to widen the jaw to some extent, and that will give us some space, but perhaps it might not give us all of the space. And so in this situation, we might do a combination style of treatment whereby we widen the top jaw to gain some space, and we get the extra space by reducing the number of teeth. So we may combine an expander together with dental extractions.